Electrocardiogram, or ECG. An electrocardiogram, or ECG, is a diagnostic tool that records your heart's electrical activity. Healthcare providers use it for many reasons, like to diagnose heart rhythm issues or to monitor how well a treatment is working. An ECG is a quick, non-invasive test that doesn't hurt. You can get an ECG while lying down and resting, or while you're exercising as part of a stress test or TMT. Some personal devices, like smartwatches, can take an ECG, but it's best to have a healthcare provider take and read your ECG. You may hear the terms EKG and ECG. Both terms mean the same thing, an electrocardiogram. EKG comes from the German word which uses K instead of C. Types of heart rhythm devices. Providers can use different types of ECG devices to monitor your heart's rhythm, depending on how long they want to evaluate it. A typical ECG has to be conducted in a medical facility and only tracks your heart's electrical activity for a very short time. It's typically 10 seconds. Types of ECG devices include 1. Standard 12-lead ECG. You get this type while sitting in a provider's office. You don't take the device home with you. 2. Short-term wearable monitor, like a Holter monitor. You wear this device for 24 to 48 hours to get continuous recording of your heart's electrical activity for that time frame. 3. Event monitor. You wear this device for a week or more. You may need to click a button to start recording when you feel symptoms. 4. Implanted loop recorder. A provider puts this type under your skin, may have it for several years. 5. Stress test ECG. A provider connects you to an ECG to take readings while you walk on a treadmill. When is this test performed? Your healthcare provider may use an ECG test to check for certain conditions. They may use it to diagnose 1. Arrhythmia, abnormal heart rhythm, or abnormal electrical conduction. 2. Poor blood flow to your heart muscle or ischemia, because of coronary artery disease. 3. An issue with your heart valves. 4. Congenital heart disease. 5. Heart attack. 6. Enlarged heart chambers. 7. Heart damage or heart failure. Providers may also use an ECG to make sure you're fit for an upcoming surgery or check your heart health if you're at a higher risk of heart disease. They may want to see how your heart is doing since you've got a pacemaker, or find out how well a new medication for heart disease is working. They may also check your heart's rhythm after a heart attack. Your provider may give you an ECG test if you have these symptoms. 1. Chest pain. 2. Shortness of breath. 3. Tiredness. For dizziness, syncope. 6. Cyanosis. 7. A flutter or skip in your heartbeat. 8. A fast heartbeat. 9. Difficulty with blood supply during physical activity. How does an ECG test work? Your own internal pacemaker starts your heartbeat with an electrical signal. An ECG reads that signal and tracks its impact on your heart, as it contracts and relaxes with each heartbeat. A computer makes the information about your heartbeats into a wave pattern your healthcare provider can interpret. How do I prepare for the test? Before an electrocardiogram, you can eat and drink like you normally would. But before you get dressed on the day of your ECG test, try 2. Avoid using oily or greasy skin creams and lotions because they keep electrodes from making good contact with your skin. Avoid full-length hosiery that prevents electrodes from touching the skin on your legs. Wear a shirt that you can remove easily to place the leads on your chest. What happens during an ECG? A healthcare provider will attach 10 electrodes with adhesive pads to the skin on your chest, arms, and legs. They'll put 6 electrodes or sensors on your chest and 4 on your limbs. The sensors send information through wires or leads, which is why people call it a 12-lead ECG. To allow a better connection, your provider may shave hair that's in the way. It takes about 5 minutes to attach the electrodes and complete the ECG test. But the actual recording takes only 10 seconds. For a resting ECG test, you'll lie flat and relax. If you're doing a stress test, you'll walk on a treadmill during the test. The electrodes will stay on your skin until the ECG test is done. What to expect after an ECG? Your healthcare provider will remove all of the sticky electrode patches, and you can return to your normal activities. What does an ECG show? When they read an ECG, your healthcare provider will look at how much electrical activity there is and how strong it is. They'll also look at how much time passes between the different waves or peaks that represent the electrical impulses. The parts of an electrocardiogram and what they represent are: 1. Your upper heart chambers, where your heartbeats start, create the first wave, or P wave. 2. Your lower heart chambers create the next wave, called a QRS complex. 3. The third wave, or T wave, shows your heart at rest or recovering after beating. By Joshi Joseph. Thank you.